What is your understanding of nurses as advocates and counselors?
I believe that being a nurse extends far beyond clinical tasks and medications. Nurses are uniquely positioned to be both advocates and counselors for their patients, and I have always embraced these roles throughout my career. As an advocate, a nurse stands beside the patient and speaks for them when they cannot speak for themselves. This means ensuring their wishes are respected, their rights are protected, and their voice is heard in healthcare decisions. I've advocated many times for patients who were too frightened or unwell to express their concerns. For example, I once cared for an elderly gentleman who was reluctant to ask questions about his treatment. I noticed his anxiety and quietly asked if he had any concerns. He admitted he did not understand his medication changes, but was too embarrassed to ask the doctor. I stayed with him, helped him write down his questions, and supported him when the doctor returned. His relief was visible, and his treatment plan was adjusted based on his concerns. Advocacy means being brave enough to speak up, even when it is uncomfortable, because the patient's well-being depends on it. As a counselor, a nurse provides emotional support and a listening ear during some of the most difficult moments in a person's life. Patients and families face fear, grief, anxiety, and uncertainty. They need someone who will listen without judgment, offer comfort, and help them navigate their emotions. I have sat with families receiving bad news, held the hand of a frightened patient before surgery, and listened to an elderly woman share memories of her late husband. Counseling as a nurse is not about giving advice or fixing problems. It is about being present, showing empathy, and creating a safe space for people to express their feelings. Sometimes the most powerful thing I can say is, "I am here with you. You are not alone." These roles require emotional intelligence, patience, and genuine compassion. They are not separate from nursing. They are at the very heart of it. Every time I step into a patient's room, I carry these responsibilities with me, knowing that my advocacy and counsel can be as healing as any medication I administer.
What are the challenges in the nursing career?
Nursing is a deeply rewarding profession, but it also comes with significant challenges that require resilience, patience, and strength. One of the biggest challenges is the emotional toll of caring for patients who are suffering and sometimes witnessing death. Holding the hand of a dying patient or comforting a grieving family leaves a mark on your heart. Learning to process these emotions while remaining compassionate and professional is a constant balancing act. Another major challenge is the physical and mental demands of the job. Long shifts, often 12 hours or more, with little time for breaks, can lead to exhaustion. Nurses are on their feet constantly, lifting and moving patients and rushing between tasks. This physical strain, combined with the mental focus required to administer medication safely and monitor patients closely, can lead to burnout if not managed carefully. Workplace stress is another significant challenge. Hospitals are often understaffed, and nurses are expected to care for more patients than is ideal. This creates pressure, increases the risk of errors, and leaves nurses feeling they cannot give each patient the attention they deserve. Dealing with difficult family members, demanding doctors, and conflicts within the team adds another layer of stress. The emotional challenge of balancing personal life with work is also real. Nurses often miss family gatherings, work holidays, and come home too tired to engage with loved ones. Maintaining relationships and self-care requires conscious effort. Continuous learning, while positive, can also be challenging. Medicine and technology evolve constantly, and nurses must keep up with new protocols, equipment, and documentation systems. This requires time and energy outside of already long shifts. Despite these challenges, I remain committed to nursing because the rewards far outweigh the difficulties. The gratitude of a patient, the trust of a family, and the knowledge that I made a difference keep me going. I have learned to manage these challenges by leaning on my team, practicing self-care, and remembering why I chose this path.
What are the challenges you will face when you reach a foreign country for a job?
Moving to a foreign country for work is an exciting opportunity, but I'm also realistic that it comes with challenges. I have thought carefully about these and prepared myself to face them with patience and a positive attitude. One challenge is the language barrier. Even though I speak English well, there may be local phrases, accents, or medical terminology that I am not familiar with at first. I will need to listen carefully, ask questions when I am unsure, and never pretend to understand something I do not. I'm also open to learning basic phrases in Maltese to connect better with clients and colleagues. Another challenge is adapting to a new culture and way of life. Everyday things like shopping, using public transport, or understanding social customs can feel unfamiliar. I know I may feel homesick at times, missing my family and the comfort of familiar routines. To cope with this, I plan to stay connected with my family through calls and messages, while also being open to building new friendships with colleagues. I believe that creating a support network will help me feel at home more quickly. Understanding new workplace protocols and expectations is another challenge. Every country has different healthcare standards, documentation systems, and ways of working. I am prepared to learn patiently, attend all training sessions, and ask for guidance from my supervisors and experienced colleagues. I am not afraid to admit when I need help. Financial adjustments during the initial settling period can also be challenging. I have saved money to support myself while I find accommodation and adjust to the cost of living. I have researched housing and expenses in the country to prepare. Finally, being away from my young son and family will be emotionally difficult, but I am doing this to build a better future for them. Their support and my determination will carry me through. I am ready to face these challenges with resilience, knowing that every difficulty is temporary and every step forward brings me closer to my goals.
How do you safely shift a bedridden patient from bed to wheelchair?
Transferring a bedridden patient from bed to wheelchair requires careful planning, proper technique, and clear communication to ensure the safety and dignity of both the patient and myself. I always begin by assessing the patient's condition and ability to assist. I check their strength, mobility, and any specific instructions in their care plan. I also ensure the wheelchair is positioned correctly, locked securely, and placed close to the bed at a slight angle for easier transfer. Before starting, I explain the entire process to the patient in simple, reassuring words. I say something like, "I'm going to help you sit up now, and then we will move you to the chair together. I will count to 3, and you can help me by pushing with your legs if you are able." This gives them a sense of control and reduces anxiety. I also ensure their modesty is protected by covering them with a blanket or sheet. I lower the bed to a safe height and help the patient sit up on the edge of the bed, allowing them time to adjust and prevent dizziness. I position myself close to them, bending my knees and keeping my back straight to protect my own body. I place one arm around their back and the other under their thighs. On the count of 3, I pivot them gently towards the wheelchair, using my legs to lift, not my back. I ask them to help by pushing with their feet if they can. Once they are seated, I ensure they are comfortable and properly positioned, with their feet on the footrest and safety belt secured if needed. Throughout the transfer, I speak calmly and encouragingly. After the move, I check that they are comfortable and ask if they need anything. This careful, respectful approach ensures safety and maintains the patient's dignity throughout the process.
Do you have any suggestions for improving clinical areas based on your experience?
Throughout my nursing career, I have always believed that reflecting on our practices and suggesting improvements is part of being a dedicated healthcare professional. Based on my experience, I have a few suggestions that could enhance clinical areas and patient care. Effective communication between shifts is an area that can always be strengthened. In busy wards, handover reports can sometimes become rushed or incomplete. I have seen the benefits of using a standardized tool like SBAR for every handover, and implementing this consistently across all clinical areas would ensure no important information is missed. This simple change improves patient safety and creates a smoother transition between teams. Regular simulation training for emergency situations is another valuable practice. In the operating room, we practiced emergency scenarios like cardiac arrest or malignant hyperthermia drills. These sessions built our confidence and ensured everyone knew their role when a real crisis occurred. Incorporating more frequent, brief simulation exercises in clinical areas would help keep skills sharp and strengthen teamwork. The importance of regular equipment checks cannot be overstated. I recall a challenging situation where equipment failure added stress to an already critical surgery. Implementing a standardized daily checklist for all essential equipment in every clinical area, with clear accountability, could prevent such emergencies before they happen. It is a small investment of time that pays enormous dividends in patient safety. Promoting staff well-being should also be a priority in clinical areas. Healthcare is stressful, and burnout directly affects patient care. Creating quiet break areas where staff can truly rest during shifts and encouraging open conversations about stress and mental health would make a significant difference. When staff feel supported and valued, they are better able to provide compassionate, attentive care to their patients. These are just a few suggestions based on my observations. I always aim to contribute positively to my workplace and will be happy to share ideas while also learning from the excellent practices already in place.
What does the term head-to-toe assessment mean?
A head-to-toe assessment is a systematic physical examination used to evaluate a patient's overall health status from the top of the head down to the toes. This structured approach ensures that no clinical details are missed during a shift change or upon admission. In my previous role on a busy medical surgical ward, I performed these assessments daily for 6 patients within the first hour of my shift. I always start by observing the patient's level of consciousness and facial symmetry before moving down to check vital signs, lung sounds, and bowel activity. During one specific night shift, I was assessing an elderly patient who seemed fine but felt slightly cooler than usual. While examining his lower extremities, I noticed his pedal pulses were significantly weaker compared to the previous day's records. I immediately tasked myself with checking his oxygen saturation and notifying the surgical resident. By acting on this specific assessment finding within 10 minutes, we identified an early arterial blockage. The patient was rushed to vascular surgery, which successfully restored blood flow. This thorough 10-minute routine is vital because it provides a baseline for the entire care team to monitor any subtle, life-threatening changes.
What do you understand by the term professional responsibility or accountability?
Professional responsibility and accountability represent the ethical and legal obligation of a nurse to provide safe, competent, and ethical care while being answerable for their own actions and omissions. To me, this means practicing within my defined scope of practice and adhering to the standards set by my regulatory body. During a particularly understaffed weekend shift in the emergency department, I was assigned to oversee 10 patients simultaneously. One patient required a complex intravenous medication that I had not been formally trained to administer in that specific setting. Despite the heavy workload and pressure from the surgical team to speed up the process, I recognized that my professional accountability required me to prioritize patient safety over speed. I immediately informed the shift coordinator that I could not safely administer the drug without supervision or prior competency sign-off. I tasked myself with finding a qualified senior nurse to witness the administration, ensuring the dosage was double-checked against the hospital's protocol. This action took an extra 15 minutes, but it prevented a potential medication error and upheld the integrity of my nursing license. By documenting the incident and my rationale, I demonstrated accountability to my patient, my employer, and the profession. Taking ownership of my limitations is just as important as performing my duties, as it ensures that the standard of care remains high even under significant environmental stress.
As a nurse, how can you ensure consistent and high standards of care to patients?
To ensure consistent and high standards of care, I strictly adhere to evidence-based protocols, clinical guidelines, and the fundamental nursing process of assessment, planning, implementation, and evaluation. Maintaining these standards requires a blend of technical proficiency and constant vigilance regarding patient safety. In my previous role on a 25-bed orthopedic ward, I was tasked with managing a high turnover of post-operative patients. To prevent complications like pressure ulcers or healthcare-associated infections, I implemented a rigorous safety huddle at the start of every 12-hour shift. This involved coordinating with 4 junior nurses and 2 healthcare assistants to identify high-risk patients who required specific interventions, such as 2-hourly repositioning or specialized wound care. During one particularly busy month where patient acuity rose by 30%, I noticed that some skin integrity checks were being documented late. I took the initiative to audit our turning clocks and introduced a visual bedside tracking system to ensure no patient was overlooked during peak medication rounds. By streamlining this process, we maintained a 0 incidence rate for hospital-acquired pressure sores over a 90-day period. Additionally, I prioritized my professional development by attending monthly clinical skills workshops to stay updated on the latest infection control measures. Accountability is key, By consistently reviewing my own practice against National Institute for Health and Care Excellence NICE guidelines, I ensure that every patient receives the same high-quality, dignified treatment regardless of how pressured the environment becomes.
What is risk management?
Risk management in nursing involves the systematic process of identifying, evaluating, and mitigating potential hazards to ensure the safety of patients, staff, and visitors. It is a proactive strategy designed to prevent clinical errors and financial losses within a healthcare setting. During my time in a busy 20-bed residential care unit, I noticed a recurring trend where multiple residents were experiencing minor falls in the communal dining area during the transition from lunch to afternoon activities. To address this risk, I conducted a week-long audit of environmental factors and staffing levels during that specific 2-hour window. I identified that the polished floor surface and a lack of supervised mobility assistance were primary contributors to these incidents. I took the initiative to present my findings to the facility manager and proposed a revised staffing rotation that placed 2 additional caregivers in the dining hall during peak transit times. We also implemented a no-slip rug policy and enhanced the lighting in the corridor leading to the lounge. Over the following 3 months, we saw a 40% reduction in fall-related incident reports, which significantly improved patient outcomes and reduced the administrative burden of reporting. By treating every near miss as a learning opportunity rather than a personal failure, I help maintain a culture of safety. Effective risk management requires constant vigilance, clear documentation, and a willingness to adapt clinical environments to meet the evolving needs of those under my care.
What are the barriers for a nurse in a new hospital?
Starting at a new hospital brings many exciting opportunities, but I also recognize there can be barriers that I will need to navigate carefully and positively. One common barrier is adapting to different policies and protocols. Every hospital has its own way of doing things, from how medications are administered to how documentation is completed. Learning these new systems takes time and focus, and I am prepared to study them thoroughly and ask questions whenever I am unsure. Another potential barrier is technology. Hospitals use different electronic health record systems, and I may need time to become proficient with a new platform. I am comfortable with computers and have adapted to new systems before, so I am confident I can learn quickly with training and practice. Language and communication can also be a barrier, especially if medical terminology or abbreviations differ from what I am used to. I will listen carefully, ask for clarification when needed, and never pretend to understand something I do not. Building relationships with a new team can be challenging at first. Existing colleagues already have established working relationships and routines. I may need to prove myself and earn their trust through reliability, hard work, and a positive attitude. I am patient and understand that trust is built over time. Cultural differences in the workplace, such as different communication styles or expectations around hierarchy, can also take adjustment. I approach these with an open mind and respect for how things are done in my new environment. Finally, the emotional barrier of being away from familiar support systems can be difficult. I prepare for this by building a routine, staying connected with family, and being open to forming new friendships with colleagues. Every barrier is temporary and can be overcome with patience, humility, and a willingness to learn. I am ready for these challenges,